A pathological narcissist is someone who exhibits an extreme and pervasive form of narcissism, which is typically classified as narcissistic personality disorder (NPD). In psychological terms, this condition goes beyond typical self-centered behavior and involves deeply ingrained patterns of grandiosity, lack of empathy, and an excessive need for admiration. Their behavior often negatively impacts their relationships, work, and overall well-being. Key traits of a pathological narcissist: grandiosity, an inflated sense of self-importance, achievements, or abilities. They may believe they are superior and deserve special treatment. Excessive need for admiration, a constant craving for attention and validation to reinforce their self-esteem. Lack of empathy, difficulty recognizing or caring about the emotions and needs of others. Exploitative behavior, using others to achieve their own goals, often with little regard for the impact on others. Preoccupation with fantasies, obsessive thoughts about success, power, beauty, or ideal love. Envy, either being envious of others or believing others are envious of them. Arrogance, acting superior or dismissive toward others, often masking underlying insecurities. Fragile self-esteem, despite their outward confidence, they are highly sensitive to criticism or perceived slights, often reacting with anger or defensiveness. Causes and development. Pathological narcissism often stems from a combination of genetic, environmental, and developmental factors, such as early childhood neglect or overindulgence, excessive praise or unrealistic expectations from caregivers, emotional trauma or feelings of inadequacy masked by a need for control. Impact on relationships. Pathological narcissists can create toxic dynamics in personal and professional relationships. Common issues include manipulation and gaslighting to maintain control, dismissing others' emotions or opinions, difficulty maintaining long-term relationships due to lack of trust and emotional depth. Management and treatment. Treating pathological narcissism is challenging, as individuals may not recognize their behavior as problematic. However, treatment options include psychotherapy, long-term therapy, for example, cognitive behavioral therapy to address underlying issues and improve interpersonal functioning, building emotional awareness, helping the individual develop empathy and manage insecurities, support groups for both the narcissist and those affected by their behavior. Understanding and dealing with a pathological narcissist requires boundaries, patience, and often professional guidance.